Hello, I am dentist Efe. A dental implant is actually an artificial replacement of the tooth, the root actually. There is different types of implants, like they have different lengths and they come in different dimensions. Choose these lengths and dimensions according to every case. And they are considerably safe actually. Last 10 years, I suppose, it's 90 to 95% of the implants were successful. The procedure begins with intraoral examination and the patient's general medical health. After that, we took a panoramic radiograph to see the general problems in the intraoral area and the bone levels. After that, if it's necessary, we took a 3D dental tomography. With that, we can see the volume of the bone and the 3D dimensions of the bone. After that, we decide where to insert the implant, how to plan the prosthodontics after we do the implants. And we look at the case in a general way, in a big picture. After that, we plan the implant. After that, we give the patient prescriptions like antibiotics and painkillers. Like 3, 4 or 7 days between that, we check the patient if it's necessary. Otherwise, the patient can safely go to his own country. After like 6 to 8 weeks, according to case, the patients return and we take an impression from the implant and we do the crown. There are two types of answer for that question actually. One of them is local, the other side of it is a systemic diseases. The local problems could be like bone level of the patient or the quality of the bone, and also there could be systemic problems with the patient that we could not do any surgical intervention to the patients, and the patients usually know their problems about this, like infective carditis or biphosphonate usage, or they are going and undergoing cancer therapy at the same time. We examine the patient with all aspects of their medical health. They do not specifically, like if the patient does not care his oral hygiene, it will, but also the natural tooth will cause bad breath as well. There is not so much of a side effect of an implant. In very rare cases, the patient may have titanium allergy because the implants are usually made of alloys which are composed of titanium, vanadium and aluminum. But if there is a such case, that we use a different material. The gingivitis is the beginning of the periodontal problems actually. It's usually caused because of the bad oral hygiene. And it's not a problem just with the implants actually. Patient can have this problem all around his mouth, and it's a generalized problem mostly actually. Sometimes it can be localized, but the patient can care their oral hygiene, but if it's in a level that the patient cannot manage itself, he or she should go to dentist, and the dentist should start a periodontal treatment. It is mostly consists of ultrasonic scaling. We have a partnership with Axera Med so that your dental treatment procedure will be smooth, and they are professional in their business, so we are very happy to work with them.